Deep inside your bone marrow, right now in this exact moment, billions of blood cells are being born, live their purpose, and die in a perfectly orchestrated biological system that has kept you alive since the day you were born. But what happens when one single cell in that system makes one single copying error? A mutation, so small it cannot be seen, so silent it causes no pain, no warning, no symptom. That one mutation is where blood cancer begins. Not in a tumor you can feel, not in an organ you can scan. Inside the factory that makes your blood, silently, invisibly, without a single warning sign. Blood cancer is not one disease. It is a family of cancers, all sharing one common origin: the uncontrolled, abnormal growth of blood cells in the bone marrow, blood, or lymphatic system. There are three major types: leukemia, cancer of white blood cells originating in the bone marrow lymphoma, cancer of the lymphatic system beginning in lymphocytes, and multiple myeloma, cancer of plasma cells, the antibody-producing soldiers of your immune system. Together, blood cancers account for approximately 10% of all cancer diagnoses globally, making them the third most common cancer type. And unlike many cancers, they can strike at any age, including children. To understand what goes wrong in blood cancer, you must first understand what goes right. Your bone marrow produces 500 billion blood cells every single day through a process called hematopoiesis, one of the most productive biological manufacturing operations in all of nature. Every blood cell begins as a hematopoietic stem cell, a master cell capable of becoming any blood cell type. These stem cells receive precise chemical instructions that guide their differentiation into the exact blood cell the body needs at that moment. Red blood cells carry oxygen. White blood cells fight infection. Platelets seal wounds. Each type, produced in precise ratios, each living a predetermined lifespan. Red cells are 120 days, neutrophils mere hours, before being recycled and replaced. Inside the bone marrow, stem cells divide approximately every 40 weeks. Each division requires copying 3 billion base pairs of DNA with extraordinary precision. But precision is never perfect, and certain factors dramatically increase the error rate. Radiation exposure, certain chemical agents, viral infections like Epstein-Barr virus, and in many cases, simply the random probabilistic errors of DNA replication. These are the triggers that introduce oncogenic mutations into blood stem cells. The critical mutations occur in genes that control cell division and cell death. Proto-oncogenes, genes that normally promote healthy growth, mutate into oncogenes, permanently stuck in the on position. Or tumor suppressor genes, the brakes on cell division, are deleted or silenced. The mutated cell now has one catastrophic advantage over every normal cell in the bone marrow. It does not die on schedule. Normal blood cells are programmed to undergo apoptosis, programmed cell death, after a fixed lifespan. The cancer cell has disabled this program. With its death program disabled and its growth accelerator permanently active, the cancer cell begins dividing exponentially. 1 becomes 2, 2 become 4, 4 becomes 16. Within weeks, a single mutated stem cell can produce millions of identical daughter cells, all carrying the same oncogenic mutation. This process is called clonal expansion. All the cancer cells are clones, genetically identical copies of that original mutated ancestor. And as they multiply, they begin to physically crowd out the normal blood-producing stem cells. As leukemic cells fill the bone marrow, they suppress the production of all normal blood cell lines. The marrow loses its ability to produce adequate red blood cells, functional white blood cells, and platelets. This is called bone marrow failure, and it is the mechanism behind every symptom of blood cancer. Red blood cell production falls, causing anemia. The patient experiences profound fatigue, breathlessness, and pallor as oxygen delivery to every tissue in the body drops below critical levels. Platelet production crashes, causing thrombocytopenia. Without enough platelets, the body loses its ability to form clots. Minor injuries cause prolonged bleeding. Spontaneous bruising appears across the skin. In severe cases, internal bleeding becomes life-threatening. Functional white blood cell production, particularly neutrophils, the first-line immune defenders, plummets. This condition is called neutropenia. And a body without neutrophils is a body with no immune defense, completely exposed to infections that a healthy immune system would destroy in hours. A blood cancer patient with neutropenia can develop life-threatening sepsis from a minor skin infection, a bacterial pneumonia from a common respiratory bug, or a fatal fungal infection from organisms that would never trouble a healthy immune system. As the bone marrow becomes overcrowded, leukemic cells spill out into the peripheral blood in massive numbers. A normal white blood cell count is 4,000 to 11,000 cells per microliter. In acute leukemia, this can exceed 100,000, a condition called hyperleukocytosis. At these extreme counts, leukemic cells can form clumps that block microvessels in the brain, lungs, and kidneys, causing strokes, respiratory failure, and organ damage through simple mechanical obstruction. Leukemia divides into 4 major subtypes based on 2 axes: the cell type of origin and the speed of progression. Acute leukemias, AML and all, develop rapidly over days to weeks from immature blast cells that have lost all ability to mature. Chronic leukemias, CML and CLL, progress over months to years from partially mature cells. In acute myeloid leukemia, the most common acute leukemia in adults, myeloid blast cells accumulate in the marrow at a catastrophic rate. These blasts are completely non-functional. They do not fight infection, carry oxygen, or clot blood. They simply exist, divide, and crowd. Chronic myeloid leukemia carries a signature mutation, the Philadelphia chromosome, PKO6A. Translocation where pieces of chromosome 9 and 22 swap positions, creating a fusion gene called BCR-ABL that produces a permanently active kinase enzyme, endlessly telling cells to divide. Lymphoma begins in lymphocytes, the T cells and B cells of your adaptive immune system. Unlike leukemia, lymphoma primarily originates outside the bone marrow, within the lymph nodes, spleen, thymus, or other lymphoid tissues scattered throughout the body. In Hodgkin lymphoma, the more treatable form, a distinctive abnormal cell called the Reed-Sternberg cell, appears in affected lymph nodes. These giant cells, with their characteristic owl eye nuclei, are the pathological signature of the disease and can be seen under microscopy. As lymphoma progresses, affected lymph nodes enlarge dramatically. The characteristic painless swelling of lymph nodes in the neck, armpits, or groin, often the first symptom a patient notices, represents lymph nodes packed with millions of cancerous lymphocytes. Multiple myeloma is a cancer of plasma cells, the highly specialized B cells that produce antibodies. In myeloma, malignant plasma cells accumulate in the bone marrow and secrete massive quantities of a dysfunctional antibody protein called M protein, a paraprotein that clogs kidneys and serves no immune function. Most destructively, myeloma cells secrete chemical signals called rank ligand that activate osteoclasts, the bone-dissolving cells, while simultaneously suppressing osteoblasts, the bone-building cells. The result is lytic bone lesions, holes punched through bone, causing pathological fractures from minimal trauma. Here is what makes blood cancer uniquely dangerous. In many subtypes, particularly chronic leukemias and low-grade lymphomas, the disease can grow silently for years, even a decade, before causing any symptom the patient can detect. During this silent period, the cancer is actively evolving, accumulating additional mutations, developing drug resistance mechanisms, and optimizing its survival strategies, all while the patient lives their normal life completely unaware. Blood cancer begins with silence, one mutation in one cell in the darkness of your bone marrow. It grows in silence, years passing, no pain, no warning. It strikes suddenly, turning a healthy life into an urgent medical emergency. But it is no longer the unconditional death sentence it once was. Through the understanding of its molecular mechanisms, the development of targeted therapies, the engineering of cellular immunotherapies, and the continuing revolution of precision medicine, blood cancer is becoming a disease we are learning to defeat. The biology that makes blood cancer so dangerous, its origin in the stem cells that give rise to all blood cells, also makes it uniquely susceptible to biological therapies that work with the immune system rather than against it. The future of blood cancer medicine is being written right now.